I'm Greg Greenfield with the South Dakota State Bar Lawyers Assistance Committee. As a lawyer, you're expected to help your clients, always be ready to help your clients, and sometimes one of the people that really needs help is you. One of the reasons I never went and asked for assistance is because I viewed asking for assistance as a sign of weakness, not a sign of strength. I've learned that asking for help is a sign of strength. Sometimes, despite our best intentions, we struggle. These struggles go by different names: anxiety, depression, addiction, abuse. If you or someone you know is struggling, please know that there's help. Life is better above the bar.
Hello, my name is Pamela Ryder. I'm president of the State Bar of South Dakota. And today we have Dr. Singh joining us from Sanford Psychiatry. Welcome to the State Bar's Lawyers Assistance Committee's Living Above the Bar series, where we will discuss a variety of health-related topics that impact us both personally and professionally. This video series will focus on substance use disorders, diagnosis and treatment therefore. But first, Dr. Singh, thank you for joining us today.
Thank you for having me.
Dr. Singh, will you help us understand the definition of a substance use disorder?
So when we talk about substance abuse disorder, it becomes a disorder clinically when it starts to impair an individual's social or personal life. So occasionally people will go out, have a drink, and that is fine. That is not a disorder. But if it starts impairing your ability to function, it leads to legal problems, it leads to problems with friends and families, that is when we classify it as a disorder. Individuals usually who will end up with disorder will also have some elements of either seeking out the drug or craving the drug. And that then leads to the next level of substance use, where we start to worry about addiction being a factor.
And Dr. Singh, what is the difference between substance use disorder and addiction?
You know, earlier the DSM used to classify them as different disorders, and in the DSM-5 they have changed it to a substance use disorder. So more recently, it is focusing on the level of impairment. So they have combined substance abuse and substance dependence into a substance use disorder. And what that basically means is that the use of that substance is causing impairment in an individual's life.
Okay. What are some of the causes of substance use disorder?
So the important causes are generally underlying mental health issues that have not been diagnosed or treated. So commonly you will see individuals with anxiety disorders. It could also be comorbid with substance abuse. It could be comorbid with depression-related symptoms. Patients who have a diagnosis of bipolar disorder, for example, have a very high rate of alcohol use associated with their mental health issues. So mental health issues generally are the underlying factors why people end up with abuse issues and addiction issues.
If someone believes that they may be suffering from a substance use disorder, what are some warning signs that they could watch for?
I think the most important warning sign is listening to friends and family around you. Generally, they will have good insight into your substance use habits. So if your substance use habits are impairing in your interpersonal relationships, if your substance abuse habits are impairing your ability to function professionally, socially, that should be a clue that you might want to go and seek some help.
Okay. So after identifying these symptoms, you mentioned that someone should go seek help. Where would someone start?
The starting point would be going and speaking with your primary care physician. I would very strongly suggest that you have an open and honest conversation with your primary care physician. And I think the most important part in a substance use interaction, if you're struggling with substance abuse, is you want to be completely honest with your primary care provider. You need to let them know how much you are drinking or what kind of substances you're using and the impact they are having on your life.
Once you receive a diagnosis of substance use disorder, in whichever degree
Sure.
it might be, what types of treatment would be available?
Generally, the treatments that focus on substance use disorder involve intensive psychotherapy. So that could include your primary care physician recommending that you might go into an inpatient chemical dependency program. It might include recommendations, you working with a chemical dependency counselor on an outpatient basis, or a mix or a combination of these forms of treatments. There are medications that have also been FDA approved for use of substance use disorders, especially alcohol. There are medications that have been shown to be effective in decreasing cravings for substances like alcohol. And then there are medicines that are also used as deterrent for alcohol use. So you can also have that conversation with your primary care physician.
I have also, Dr. Singh, heard that there are different types of alcoholism, where it might be someone who craves it every day, but there's also called binge alcoholism or binge
Yes.
drinking. What's the difference?
Individuals who usually struggle with binge drinking struggle with impulse control. That means that they'll go out socially. So they might not drink for 7-10 days or a couple of weeks at a time, but when they start to go out and they start drinking, they have difficulty refraining from excessive use of alcohol, and they will end up drinking excessive amount of alcohol, and that is what will lead to impairment.
What can we do to prevent substance use disorder?
I think if you have a family history, if you have a known family history of substance use in your family, I would recommend you be very, very cognizant of that fact and be very careful about using substances. I would also recommend that if you feel like you have an underlying mental health issue, maybe it is a little bit of depression, maybe it's a little bit of anxiety, you seek treatment for those underlying mental health issues and address those underlying issues rather than trying to medicate those issues by yourself.
Thank you, Dr. Singh, for sharing with us your insight regarding substance use disorder. And thank you to those of you who have taken the time to view this portion of our Living Above the Bar series. Take care.